It's time to focus on seniors with Helping Seniors TV. The television show designed to make you aware of senior issues and needs, as well as to acquaint you with the resources available to help you age in place and with dignity. Now, here's your host, Joe Steckler.
I'm Joe Steckler, and welcome to Helping Seniors, the television arm of Helping Seniors of Brevard County. Our show is designed to provide you with information on how to develop your own aging and care plans. Our topic today is SHINE, Serving the Health Insurance Needs of Elders. And joining me today is Lance Jarvis, who is the co-area coordinator for SHINE in Brevard County. Welcome, Lance.
Great to be here, Joe. Thanks for having me.
You're quite welcome. It's not you should be thanking me, it should be me thanking you. And you viewers are going to be treated as something today that should be, it could be and is extremely important to you and for you to develop your own better knowledge of what Lance is going to talk about. Because I wasn't aware, as many shows as I've done about SHINE, I wasn't aware of the significance of the true spirit of volunteerism that a SHINE counselor brings to the table, Lance. And I would, just as we simply start this show, I would like for you to tell our viewers what SHINE is, what you do, and the backgrounds of the people that you have and how you train them.
Great, Joe. Happy to. As you mentioned, SHINE stands for Serving Health Insurance Needs of Elders. SHINE is an award-winning statewide program that's part of the Florida Department of Elder Affairs that counsels seniors and others who are on Medicare on a wide variety of different matters. We counsel seniors as well as those who are newly on Medicare through a disability. They're well under 65. We help them to understand how Medicare works, what their options are to get their Medicare benefits, and all of the SHINE counselors, there are 600 statewide and 35 here in Brevard, all are volunteers, very well-trained volunteers, but all are volunteers. The counsel that we provide is completely free. It is totally objective. We sell nothing. We do not sell insurance.
You do sell something.
We sell service to our clients.
You sell service and you sell information that they can take to the bank, because you owe no allegiance to any insurance company or to anybody other than the people of Florida. And that's what makes SHINE different from other insurance counseling concerns. I believe that.
Quite right. We are completely committed to the needs of the clients that we serve. We serve no other master because we have no allegiance to any insurance company of any sort. The only thing that matters is the needs of the clients that we meet with or speak to over the phone. And so we can be completely objective and unbiased in assisting them to choose the right plans for them.
That's a good word. Unbiased, choosing the correct plan for the person. How do you help people do that, Lance? I'm asking this for my information myself.
Joe, we do a good job of listening, first of all, because if we're going to assist somebody to choose a plan, whether it's a Medicare Advantage plan or a Medicare Supplement plan or a prescription drug plan, the first thing that we need to do is to ask a lot of questions of the client. Finding out, for example, what plan or plans their doctors will accept, what prescriptions they take, whether or not they are snowbirds here in Brevard County,
Why would that make a difference?
It makes a difference, Joe, because with original Medicare, the red, white, and blue card.
Right? The one I washed in the washing machine. I got to get replaced.
Yes,
Okay.
that's the one. You can go to any doctor that accepts Medicare anywhere in the continental United States and 4 foreign territories. Medicare Advantage plans, which are plans offered by private insurance companies that have a contract with Medicare, there are more restrictions on where you can get your medical services, restrictions not only in terms of which specific doctors in the community, but geographic limitations on where you can find providers that will serve you. So for a snowbird, it doesn't always work out very well to have anything other than original Medicare.
Why? And I have asked myself this question, and I've talked to other people about it. Why in the world would somebody select a Medicare Advantage plan over just straight Medicare? Can you tell me why?
Sure, I can give you several reasons that people choose to go with a Medicare Advantage plan rather than original Medicare, a Medicare supplement, and a prescription drug plan. People often choose that option, or they choose a Medicare Advantage plan, which rolls everything into one package.
Okay, but say strict Medicare doesn't roll the prescription and all. You have to have 3 separate plans. Explain it.
Okay, with original Medicare, Joe, which has 2 parts. Part A, which is hospitalization.
Okay, I understand that part.
Part B, which is physician services.
Okay.
You have deductibles and coinsurance. There's a deductible for Part B services of $147 a year, plus a 20% coinsurance based on what Medicare allows for whatever service the doctor provided.
And that's why you need your supplemental plan.
It's for that reason that people get a Medicare supplement, because original Medicare leaves you with an open-ended financial liability. Those 20% can really add up.
Yes, it can.
In a year where you need lots of medical services. So people get a Medicare supplement. And we help people choose Medicare supplements. And it's not always easy because there are 10 different Medicare supplement plans, and there may be 20 or 30 companies that offer each of those 10 plans. But neither the supplement nor original Medicare covers prescriptions.
Lance, with all the confusion that people seem to have between understanding the advantages or disadvantages of Medicare and Medicare Advantage, how about describing for our viewing audience the differences between Medicare and Medicare Advantage?
Sure. With original Medicare, let's call that original Medicare, the red, white, and blue card that often ends up in the washing machine.
Yeah, that was my words. Go ahead.
The cardboard card. With original Medicare, you can go to any doctor that accepts Medicare, anywhere in the continental United States and 4 foreign territories.
Okay.
Any hospital, any diagnostic facility, Medicare is recognized and accepted almost universally. Medicare Advantage plans are plans offered by private insurance companies that have a contract with Medicare. Many of them, if not most, are HMOs. And that means that you must use the network of physicians that are contracted with that plan.
Okay, I understand that.
And that often means that not every doctor that you might wish to see will be participating in any particular HMO plan. And in addition, you must use the facilities, the hospitals, the diagnostic facilities that plan has contracted with. Oftentimes, those facilities and physicians are located in a narrow geographic area. It could be Brevard County plus a couple of other counties, and all of your physicians that you can see are in those couple of counties. With original Medicare, of course, you can go almost anywhere. What attracts people to Medicare Advantage plans? Well, remember, original Medicare is a plan in which there is a deductible of $147 for certain services every year. There is a deductible if you are admitted to a hospital. And so many people who go with original Medicare also feel that it's necessary for them to have a Medicare supplement or a Medigap policy.
I had that.
Okay. That covers them for the financial liability of all those co-payments and deductibles. Well, there's a premium associated with that Medicare supplement.
Right.
With original Medicare and a supplement, you still need a Part D prescription drug plan because neither Medicare originally or a supplement covers prescription drugs. So there's a premium associated with that. So why do people choose Medicare Advantage plans rather than having 3 separate premiums? A premium for Part B, a premium for the Medicare supplement, and a premium for Part D prescription drugs. Medicare Advantage plans, most that are offered here, have no premium at all beyond what you pay for Part B, as in boy, your normal $104.90 premium. So month to month, there can be a significant savings by having a Medicare Advantage plan. But of course, it comes with the limitation.
The biggest limitation I see is my ability to maintain the doctor I may have wanted to maintain. I might not be able to keep my doctor. I may not be able to go to the facilities I want to go. Because an HMO, most of them have all the diagnostic, have all the doctors, have everything within their network.
Yes.
And you can't, unless it's an emergency, if you're traveling, you, just for a normal health problem, you can't go outside that network.
That is correct.
But if you're traveling and you have a Medicare Advantage plan and you have an emergency situation, they still must cover it.
Yes. It is a requirement of all Medicare Advantage plans that if there's a medical emergency, the beneficiary can go to any emergency room anywhere to have that emergency immediately taken care of.
Okay. Is there enough of a reason, by virtue of the Part D coverage under prescriptions, can a case be made for a Medicare Advantage plan being superior to anything else, weighing all advantage and disadvantage by or cost of prescription drugs? Tough question.
Joe,
I
yeah,
know.
it's a tough question because we all have different needs. Medicare Advantage plans do oftentimes offer some benefits that Medicare does not. For example, many Medicare Advantage plans have a silver sneakers arrangement where you get a free membership to a health club.
I know, and I think that's I don't like that.
Well, for some people that's important.
Yeah, but how many people use it?
Well, they think they'll use it,
Yeah,
and I guess some people do.
I know.
Medicare Advantage plans sometimes offer limited dental and vision services that Medicare does not cover.
Now, see, I didn't know that.
Each plan is a little bit different. Each Medicare Advantage plan is a little bit different. So some offer more extras than other plans do. So we really need to, when we're counseling, we really sit down and ask clients lots of questions. If they're doing a lot of out-of-state traveling, if they say, you know, we're going to spend the next 12 months in our motorhome going around the United States. Well, you know, a Medicare Advantage plan is something you really want to think carefully about before you do that, because unless you have a medical emergency, you're not covered when you're out of the geographic area of the plan.
But once you select one of these plans, can you move in and out of it?
Every year, Joe, during Medicare's annual open enrollment period between October 15th and December 7th, you can change from your Medicare Advantage plan back to original Medicare. You can switch from one Medicare Advantage plan to another Medicare Advantage plan. If you have a separate prescription drug plan, you can switch to a different prescription drug plan. So Medicare has allowed for the notion that people's needs change over the years and permits people to make significant changes during this annual open enrollment period, which is when SHINE is at its busiest.
I know. We did a radio show during that because
Yes, we did.
You know, the mission of helping seniors, the organization which sponsors our TV shows and radio shows and everything, our primary mission is to inform, to educate, and connect people to resources. How do you all train these people to do all this?
It's a great question.
And be a volunteer doing it?
Being a SHINE volunteer is not the easiest volunteer job in Brevard. SHINE volunteers go through a substantial, intensive training program. 3 solid days of classroom instruction. After that, they have to take an exam. They have to pass that exam with a pretty high score in order to continue their path toward becoming a SHINE volunteer. Then they have to go through an FBI background check. Because what you and I are talking about, when we're asking people what their needs are and we're trying to help them to understand their different options, there are questions that we need to ask that can be rather confidential. SHINE wants to make sure that the individual who does the counseling is knowledgeable and can be trusted with the information that's provided. After a SHINE counselor goes through the FBI background check and all of that training, they are then mentored for a minimum of 6 weeks with an experienced SHINE counselor to ensure that they become familiar with the process that we use to interview clients, that they learn how to listen very carefully and ask the right questions to elicit the information that allows us to help the client. So yeah, SHINE counselors go through a lot of training, and we, first of all, need to be good listeners and to ask the right questions. And that's something that SHINE counselors learn.
Before we even started the show, we were talking in another office about who qualifies for SHINE services. And you mentioned words medically handicapped or medically disadvantaged. I think that our viewers should know more about the services that you can, other categories of people that you can serve other than just straight Medicare 65 and over. Can you talk a little bit about that?
Sure. Not everybody that's on Medicare or qualifies for Medicare is a senior. People who are granted disability by the federal government get Medicare in their 25th month of disability. It's given to them automatically. They too are strong candidates to be SHINE clients because they need to know how Medicare works, what their options are to get Medicare benefits, and they usually need help in selecting a plan. It's important to keep in mind now, when we help select a plan, we don't select a plan for them. We're objective. We help to narrow down the range of possible plans and options to just a few that the client can consider. But what's important here is that not all of our clients are seniors, and not all of them have an easy time affording their medical care. So one of the things that S.H.I.N.E does is pre-qualifies, and I use the word pre-qualify deliberately, pre-qualifies people to find out if they are eligible for federal or state financial assistance with their Medicare expenses, medical
What
expenses.
do you mean by that?
Well, the state has programs that help to pay for Medicare premiums, and in some cases, for low-income clients, there is assistance in even paying the co-payments and the co-insurance, so that when they go to a doctor, they don't have to pay anything, and their Medicare Part B premium can be free if their income is low and their financial assets are very limited.
This is an area that's never been discussed on any of our shows.
No, we assist lots of folks in getting financial assistance. So one program is through the state's Medicare program, and we assist people to both qualify for, well, we find out if they qualify.
Wait a minute, you said Medicare, did you mean Medicaid?
Yeah, Medicaid. I'm sorry, Joe.
Okay,
Yeah.
okay.
The state Medicaid program
Okay.
does assist Medicare beneficiaries who are low income and have minimal financial assets.
Wait a minute, are you saying that if a person is 65 and they're living on, say, disability of $800 or $900 a month, you could possibly qualify that for them
Yes.
for paying their Part B and their
And if their income is low enough, also paying for their medical services, their co-payments.
where would that money come from?
That's the Medicaid money is a combination of state money and federal money.
Right?
The program is administered by the state of Florida through its Medicaid program.
But do you help them do that, or
Oh, yes,
does
we do.
DCF do that?
We find out if they qualify. If they seem to qualify, and then we either provide them with an application or send them to an office that will fill out the application form for them on a computer. All of that is done for them.
Do you follow up these people to help them, or is that something a SHINE counselor does?
We encourage people to call us if they get that benefit so we can tell them how to make the best use of the Medicaid benefit that they're getting.
Why? How in the world can I be in this business for 25 years and never heard what you just said?
Well,
I've never.
You've never come to S.H.I.N.E, Joe.
Well, no, I admit, no, I haven't come to SHINE. But it probably proves why we need to do more SHINE interviews on TV and on radio so people know more about it.
The program I'm talking about is called the Medicare Savings Program. The program is administered by the Department of Children and Families of the state of Florida. We have the applications. We can tell people how to apply online, which is the best and fastest way to do it. It's a rather simple application. And that's one type of assistance we can provide. Many people, as you probably know, have trouble affording their prescriptions.
All the time.
You hear about that all the time. Well, the federal government has a program called Extra Help, which provides low-cost prescriptions and, in many cases, totally free Part D prescription plans.
Do you have to be 65 or older?
You have to be on Medicare. You do not have to be over 65.
As long as you're on Medicare.
Yes. And so we help people pre-qualify them to see if they are likely to be accepted into that program. And once again, we can provide the applications and we can show people how to apply online. These are two wonderful benefits that our lower income clients and those who have limited financial assets can benefit from. And we know what it takes to qualify. We have the numbers in every office.
I'm amazed. Vera, I tell you, I have learned in the 27 minutes we've talked, I have learned some things I did not know before, and our information specialist at Helping Seniors is certainly going to know about it so they can do more help getting people, and that's why people need to talk to SHINE coordinators.
Sure it is.
And how many SHINE offices do you have here in Brevard County?
I'm glad you asked. There are 12 locations throughout Brevard County at which SHINE counselors can be found. They're located from Titusville down to Palm Bay. And to reach a SHINE counselor, call 321-752-8080. That's
Say
the
that
local
again,
number.
because we're out of time.
321-752-8080, and you will be connected to a SHINE counselor.
Lance, thank you. I have learned myself today. This has been one of the most beneficial television shows I've done in over 300 shows. I want you to know that. And I want to thank you, viewer, for watching, because I think that you'll see that the information that you've acquired today is going to help a lot of people. We're just talking now.
Okay.
Yeah. So
No, you didn't know about the financial assistance program.
I didn't know about that.
Oh, they're great.
I did not know about
They're both simple applications. We have the schedule of income and asset limits.
Yeah.